Let's talk. We've talked a lot about privacy, and I have a bill out right now, HR 6082, which has to do with realigning Part Two, and helps with, in my opinion, the provider getting the information they need. My colleague from Indiana just brought up that there is obviously a need for doctors to get more adequate information about the patient. Do you feel right now with 42 CFR Part 2, with them being realigned outside of HIPAA, do you think that hinders the provider from getting the adequate information on the individual?
Well, as you know, that it is a very controversial. We've had a number of people lobby, come to us on both sides of that coin. I'm going to defer to my colleagues at SAMHSA and the Deputy Secretary. I know the Deputy Secretary is reading a regulatory sprint for coordinated care, looking specifically at the issues around 42 CFR Part 2. So I'm going to, because they're the primary agency, I think I'm going to defer to them on that.
I read in your agency's draft clinician burden report published last month that the healthcare providers struggle to navigate health IT privacy regulations governed by 42 CFR Part 2. Is that correct?
Yes.
So what exactly do they struggle with then?
What we've heard as the struggles are around knowing when. I think one of the big struggles, there's some others, but one of the big ones is knowing who's actually covered. So the technical language is that providers who provide a specialized class of substance use treatment are covered. But if you're part of a larger entity, right? So if you're a big, delivery system, who's covered, right? Is that psychiatry? Is it just that practice? Those boundaries are very hard to navigate for folks. That boundary and that description generates, and so people default to just saying it might all be covered. Nobody wants to risk it, and
so does Part 2 strengthen the patient's care or worsen it then?
I think that, again, I'm going to defer to SAMHSA. I think we'll have some data on that. I want to be.
Well, we already know that there's been accidental deaths because of Part 2 not aligned with HIPAA. Mm-hmm. We're talking about the patient. We also talk about privacy too.
Yeah.
But through HIPAA, individuals with heart disease or HIV, do you think they're adequately covered through privacy through HIPAA?
I think HIPAA does a great job with privacy.
So, in your opinion, then, is it right that we separate individual with mental illness or disorders or abuse disorders separate from anybody else's care?
Well, I think there's a overall goal to get those things integrated, to have what sort of folks call holistic care. The specifics I'm going to defer to the specific agency that handles that, but I think there's an overall desire to have integrated care. I think that's just good patient care. All of these things blend together.
One last question then. How difficult is it for a provider to access Part 2, and what risk comes along with that?
Well, I think that the difficulty is not in the access. It's the difficulty is in the availability.
They can't just access, so they got to get the patient's. They got to get the patient's permissions, right?
Yes.
So they had to get HIPAA permission, and then they have to go one step further, and they have to ask for that, right?
Yes.
So if the provider has no reason to ask, doesn't that create a problem right there?
Potentially, it does.
Now, what if the patient shows up in the emergency room is unconscious? How many providers automatically access Part 2?
I do not know the answer to that. I can see if there's information on that. I do not have information on that. As a practical matter, in the emergency department, if they're unconscious, we try to treat them immediately.
Well, I know, but
part of that will be giving Narcan.
Part
of that will be an assumption for many patients, far more. We will assume in many cases, that there is an opioid, and a standard part of that treatment is to administer Narcan or some version of that, on the possibility that that might be the cause. I mean, we administer things like glucose on the thought that maybe the person's hypoglycemic as well.
So do you think it would improve the patient's care if we could align Part 2 and HIPAA?
I think alignment there, I think that would be helpful.
Thank you. I yield back. Thank you, Mr. Chairman.